So for those of you looking at your agenda, you may be a little confused. I am not Dr. Bonnie Rose. Unfortunately, she had a last-minute scheduling conflict, so I will be filling in. Also, if you look at the agenda, it lists this section as the Way to Wellville update, and I'm going to try to step back a little bit and broaden the scope to give you a better overview of the Creating a Healthier Niagara Falls initiative that was started by Mayor Paul Deister in 2009, and which includes the Way to Wellville. So the purpose of the Creating a Healthier Niagara Falls initiative, the goals and objectives of the initiative are driven by the input of residents. The idea is to better connect and work side by side with community members. Dozens of organizations and agencies have already come together to connect, share resources, and programming, and to better understand and collectively implement the overall vision of a healthier Niagara Falls. So here's a little kind of visual of the partnership structure, and as you can see, there are three core pieces to this structure, as illustrated. The Create a Healthier Niagara Falls Collaborative, Inc. is a recently created 501c3 organization. The Mayor's Leadership Council to Create a Healthier Niagara Falls, and the community itself, which is represented by organized community work groups. As the initiative has progressed, gears have been added to this machine, such as the Way to Wellville, and try to briefly explain what the Way to Wellville actually is. It's more or less a challenge involving 5 communities that have identified five health-related metrics that they will work over the next 5 years to improve. The City of Niagara Falls was one of those 5 communities that were chosen out of a pool of 42. The challenge was created by an angel investor by the name of Esther Dyson, who is a journalist turned tech analyst turned philanthropist in the fields of healthcare, digital technology, space exploration, and many other areas. Esther started an organization called HICCUP, which stands for the Health Initiative Coordinating Council, and this organization oversees the challenge and provides technical assistance to the 5 communities involved. So really the bottom line for the Way to Wellville is that it is about technical assistance and connections to additional resources for the City of Niagara Falls through this collaborative partnership. So again, it's just another cog in that machine. So that's as much as I can explain on that one. So now to break it down into its pieces, those 3 pieces that I mentioned, the 3 gears. The Mayor's Leadership Council was, again, formed by, and it was originally called the Mayor's Task Group to Create a Healthier Niagara Falls, launched in 2009 by Mayor Paul Deister with the assistance of a National Urban Fellow named Kathy Mays. The task group has worked most recently to develop the Creating Healthier Niagara Falls strategic plan. This is the leadership group of the collaborative that includes several of those stakeholders, those dozens of people that I've already mentioned, across a diverse spectrum of service offerings. The community work groups, this is the meat and potatoes of the collaborative. Each of the community work groups is currently working with facilitators to develop an implementable strategic plan of their own that is specific to their each focus area. Those community work groups currently included are focused on housing, transportation, food in the built environment, employment, resident engagement, and healthy behaviors. And again, the 501c3, this is pretty straightforward. It's the umbrella, it's the oversight of the collaborative actions, and this is the board of directors that has the fiduciary and the grant administration responsibilities. So the Niagara Falls Strategic Plan, again, this is one of the more recent outputs from the Leadership Council of Creating Healthier Niagara Falls. The goal of the strategic plan is, broadly to improve health outcomes in Niagara Falls by addressing the social determinants of health. This is kind of a different approach to community health. Typically, when you think of ways to improve health, you think of, for example, addressing chronic disease such as diabetes or heart disease. And this approach kind of takes a step back from that and looks at those social determinants, which are the underlying social impacts on community health. The social determinants listed in the logic model match up with those community work groups that I already mentioned. They are limited transportation, unsafe, unhealthy housing, limited local hiring, limited employment preparation, limited and unhealthy built-in food environment. So again, the process includes resident engagement and activation with outcomes that include reductions in teen pregnancy rates, and reductions in the high obesity rates, rates of chronic disease, including not only diabetes and heart disease, but depression and addiction as well, which we have classified as chronic diseases for this purpose. The model relies on successfully addressing those social determinants first, and then to best realize those anticipated outcomes. I'm not going to go through every single one of these objectives, but broadly, this is the four core goals of the strategic plan. I'm happy if anyone is interested. If you want to come up to me, I could send you the full strategic plan. But so this is goal 1. Children and adults of Niagara Falls lead productive and satisfying lives. Pretty broad. The objectives break that down a little further. Goal 2, all Niagara Falls residents value the overall health and well-being of themselves and their community. And again, the objectives break that down. And the objectives for each of the goals kind of tie in those 5 social determinants of health that I already mentioned. So every work group is really responsible for several parts of several different goals, if that makes any sense. Goal 3, Niagara Falls residents practice healthy behaviors. Again, I'm not going to go through the objectives, but there they are. And goal 4, all Niagara Falls residents will have lifelong good mental and physical health. So that's, the quick update. I'm trying to speed it up a little bit so we can get to some more, I don't want to say important, but some other folks here, and I'll save some time. But if there are any quick questions, I can do my best to answer, or you can catch me later and I can answer them one-on-one. Christine? I don't believe there is yet, but it's under construction. Okay. All right. On to the next one. I will now introduce Kathy Grancelli, CEO of the YMCA of Niagara. YWCA. YWCA.